working in the but I thought it was useful to touch base with any of you working in the driving field, just to see how things are going, see if there's things that we can learn from each other, if there's things that are, you know, really worrying you or that you're really struggling with. You know, it's just an opportunity to talk to others in the field as such. So what I'm going to do is I'm just going to try to go around the screen and try to get everybody, but just to give you an opportunity to introduce yourself and to say who you are, where, you know, what organisation you're with, and really just a couple of sentences about your experience over the last few months. You know, if you have a particular interest in this session, you know, we'll note it down at this stage. And then Tim from CTA is going to share a little bit about his experiences since we last met and talked about this subject. And then Lauren from our own driving scheme and Volunteer Now is going to share what we've been doing. And I don't think any of us would claim to have all the answers. So really after that, then there'll just be a question and answer and just a discussion opportunity just to look at a few of the issues in more detail. So if people are happy with that, I will try, and if I leave anybody out, please do shout at the end. So when I come to you, please, if you just unmute yourself, and as I say, just very briefly, do a bit of an introduction, just so as we know exactly who we have with us today. So Leslie Ann, I think you're the first one on the top of my screen.
Hiya, can you hear me okay? Yeah.
Yes.
Yeah, I'm Leslie Ann Miller and I work for Southampton Community Transport. And as Tim and the rest of the community transport partnerships will tell you, we were off the road completely, as in transporting passengers for about 3 months, although we did do the prepaid shopping and prescriptions and food parcels. So our volunteers are back from about August, and we felt that we would get them in, tell them what we were planning on doing, and give them the opportunity to say whether they wanted to opt in or opt out. So out of our volunteers, I think about a third of them are actually volunteering every day for us now. Some of them felt it was just a wee bit too early for them, and they wanted to wait until later on. So we have about a third of our volunteers currently volunteering for us now at the moment.
Perfect. Okay. Deborah?
Yes, I'm Deborah from Down Community Transport. So we cover Down, North Down and Ards, the rural areas. Yes, our volunteer scheme ended naturally about mid-March. We asked them, you know, who wanted to continue, and most of them were late 60s, early 70s. Some of them were shielding underlying health problems. The 1st of July, we asked who wants to come back. So out of 25 very regular volunteers, only 6 said they wanted to come back. We would mainly use our volunteers to go to out-of-area hospital appointments. We only have Down Hospital and the Ards Hospital within our operational area. So mostly we use the scheme to bring them to Musgrave, the Royal, you know, hospital appointments. So 6 were willing to come back, and we really probably last month only used 3 of them for people who really had no other options. So we did up new guidelines. We sent them to the volunteers about cleaning and PPE and stuff like that. We also then send that out when anybody books an out-of-area hospital appointment. So as much as the scheme is back, it's terribly limited. I think we did 10 trips last month, which would be minimal compared to what we're used to, but we really are just restricted use.
Okay, thanks, Deborah. Lindsay, do you want to introduce yourself?
Hi everybody, I'm Lindsay Armstrong. I'm Community Projects Manager at Volunteer Now, and we provide a range of services for vulnerable older people across Belfast. One of those services is our volunteer driving scheme, which we use to transport vulnerable older people to maybe a hospital appointment or medical appointment, or it could be something related to health and well-being. When lockdown occurred, obviously lots of those appointments sort of came naturally to an end, but we still managed through lockdown a very small number of drives for very vulnerable people that needed to have essential hospital treatment that was continuing through that time. So the scheme did continue to run at a very, very, very small level, but we felt it was important to do that in terms of ensuring those really vulnerable people got to where they needed to go. We also have a transport scheme for Ards and North Down as well, and I'll let Judith talk a wee bit about that, and that is for looked after children. So I'll not go into too much detail because I know Lauren will talk a little bit about the driving scheme and what we've done, and I don't want to steal her thunder because she'll shout at me afterwards.
Fine.
So I'll leave you in suspense, but yeah, we're taking on board what you're saying in terms of very similar in terms of going out and checking with our volunteers who still wants to continue to drive and in what capacity, and looking at all the good practice and the risk assessments around going forward as well.
Perfect. Catherine?
Hi everybody, I'm Catherine. I am a volunteer at the Turnaround Project in Belfast. I don't know if you've heard of the Turnaround Project. Basically, we work with ex-offenders to try and get them back into employment, and we have 2 social enterprises that they will take part in for up to a year so that they can get used to the world of work. The 2 social enterprises, one is grounds maintenance, so very often they will need a lift to the site, and then more specifically, I had a specific need for a volunteer driver to take one of the trainees to some hospital appointments. At the moment, so I'm volunteering and I'm kind of the volunteer recruiter. We don't have any volunteers yet, so it's very early days for me. So why I'm here is really just to make sure that when I do start to recruit volunteer drivers, and it sounds like I'll be lucky to get 1 or 2. I need to make sure that I'm protecting them and the trainee, and I wanted to get some guidance on good practice and health and safety. And very kindly, Victoria has sent me some very good information on that, but had recommended that I might be able to come here and get some more information.
Perfect. Okay. Victoria, we'll come to you next then.
Sorry about that. Couldn't find my unmute. I'm Victoria. I work at Volunteer now in the Community Projects team. I actually coordinate the befriending scheme, but I work really closely with Lauren, supporting the same people. We would cross cover for each other also whenever we're off. So I just wanted to participate today just to find out what everyone's doing, how everyone's feeling.
Perfect. Okay. Lisa?
Hi everybody, I'm Lisa Duty from the Now Project. I'm Communities Outreach Officer, so my role mainly is recruiting volunteers and organising social groups. So obviously when lockdown came off, we could no longer facilitate our social groups across our board. We have 9 social groups within the Belfast area, within our trust area, and we had to move them all online. So we run them over Zoom classes and closed Facebook pages, and they've become very popular. We're hoping to in the next month or 2, all depending on obviously the announcement they're going to make today, whether we are able to move forward with that plan, is hopefully do some outside gardening work and move the groups into groups of 4, front of the room and back of the room, with member staff and a volunteer. So that's the plans for the future, if we're allowed to after tonight, and then hopefully move bigger and bigger and introduce more people to each group as we're allowed to, as the restrictions ease. The building is divided into 2 sections. We have brought our transition groups back. We followed all the guidelines, one-way system, social distancing, everybody's their own workstation, temperature checks coming in through the doors, health checks with the parents and carers of the participants as well. So we've strict guidelines in place and it seems to be working at present. The only difficulty we're having at the moment is volunteers. We're not going to do any recruitment over the next couple of months because we don't have any positions available. Because you have to limit the amount of participants, you have to control the amount of people that are in the building. We have to keep that for our participants and our staff, and recruiting more volunteers, which means then you have an extra body in the building, which we can't at the moment manage. So hopefully going forward, if the restrictions ease, we hope to get our volunteers back in the building. But at present, all volunteers are working on our online Zoom calls with us and in the garden by themselves without any participants. So that's
Excellent.
At present, that's how we're doing it.
Thanks, Lisa. Jamie, can I come to you next?
Particularly to Lindsay, Victoria and Lauren, long time no speak. So my name's Jamie Greer and I'm the project coordinator for Be Collective at Volunteer Now. I'm hoping, I know I've spoken to some of you, but I'm hoping everybody knows about Be Collective. It's our new platform replacing our old search engine on our website. And on top of that, it's also a online management toolkit for volunteer involving organizations. So if you haven't heard about it, it's here. It launched in January and it's completely free of charge. We will help you get your group page, your organization set up so you can start using it to advertise for your volunteers and do your recruitment, as well as show you all the functionality that you can use the platform for example, running reports and keeping in touch with your volunteers and all that sort of thing. So if you want to have a wee look at it yourselves, called Be Collective, and please get in touch if you want to hear any more, and hopefully the system will be able to support you in whatever your driving schemes need in the next while. So thank you.
Okay, thanks, Jamie. Davina?
I'll do that first. Good morning, everybody. Yes, I'm Davina Coulters. I'm the Health Promotion Coordinator down at the Old Kelty Living Centre in Lisnaskea. So I suppose my role is really about activities and trying to look after people's health and well-being. And one of those roles is actually I've been running as a social care scheme for about the last 10 years or so. So whenever COVID hit, it was a big letdown with the volunteers in regards that most of them are retired, so there's a vulnerability there with regard to shielding and have underlying health conditions. So we had to stand the project down completely, but we did recruit in regards to volunteers coming in to help out with deliveries with medication and food parcels and things like that. And we had a wonderful response of 25 people actually stood up for that scheme. So I'm at the stage now of what am I going to do in regards to our door-to-door appointments and getting everybody in regards to volunteers, and is there capacity to really get this scheme back up off the ground again in regards to those volunteers that have been so faithful over the last number of years in helping us out with hospital appointments and the local appointments. We live in a very rural geographical area. We're 25 miles from the hospital, and then particularly one of the areas that we actually work in, Rosslea, is very remote, and there's only one bus coming in there every week. So it's a big need, and there's a very high older people's population as well in those areas. So we've those are things to address. So I'm just really on the platform today just to see where everybody else is at and how everybody else is managing. So I'm looking forward to being part of your program this morning. So thank you.
Thank you, Davina. Judith, can I come to you next? That's you.
Okay. My name is Judith and I work for Volunteer Now, and I'm project coordinator for Ards and Northdown Voluntary Transport Service, and it's looking for it's coordinating transport for children and families in care. When lockdown happened, we had very few runs during April. May and June and July have picked up again. Now I would have 12 out of the 24 drivers who would still do regular runs for me. It's been a challenge, and now with schools being back again as well, that's been challenging too. But my volunteers have risen to the occasion, and things are okay at the minute. Thank you.
Good. Okay. Paddy, can I come to you next?
Yeah, hi folks. My name is Paddy McEldowney. I manage EasyLink Community Transport. We provide rural transport services across Derry, Strabane and Omagh. We have about 35 active volunteers before lockdown. We stopped providing all passenger transport for April, May, June. We started a wee bit in July with appointments only, and a bit more in August. But like I think was it Leslie Ann explained, or Deborah, that we checked then who's up for coming back and who's not, with a range of protocols in place, like hand sanitizing in and out of the vehicle, wearing face coverings, keeping the vehicle ventilated with the windows down a bit if possible. We have about probably more than half of our volunteers saying we're happy to go again, but I'm actually concerned. I've instructed my staff to use our volunteers as little as possible, because I still think it's the most risky with regard to the COVID transmission. It's the riskiest thing we're doing. We've got people in a 16-seater minibus, and we're restricting that to 5 people, and they're a good 2 meters apart, and it's a bigger vehicle and there's a bit more ventilation, and we can put a screen around our driver and stuff. So I think the car scheme is still quite a risky activity, and even though we have volunteers wanting to come back, I'm a wee bit cautious about just going full hog again and just taking bookings and just getting back out there. I still think that some of our volunteers mean very well and are mad keen, and they miss the crack of it, and they miss the reason a lot of volunteers do it is because they're at a loose end and they're a bit lonely, and they're a bit, so for them there's a social aspect to it too. And I'm a wee bit concerned that some of our volunteers, that's overriding maybe their own safety. So I'm still concerned about the volunteer car scheme as a way forward, and I'm very concerned that if there's any social distancing guidelines in place at all, that makes the car scheme difficult, and that's probably the last thing that's going to be lifted. We could be in this situation for 18 months, who knows? So for us, we were delivering a quarter of our trips through our volunteer car scheme, so it's a huge chunk of our activity. So I'm concerned about the long term. I don't think, whatever we decide to do now, whether we sort of bend the regulations a wee bit on the distancing and just go for it because the service is more important than being ultra cautious, or whether we have that duty of care for our volunteers, which means we can't provide the same service we provided before. So that's what's I'm arguing with myself on a daily basis with that.
Well, we'll all argue that together later, because that is exactly the key challenge, isn't it? So no, thanks, Paddy, for that. Absolutely. Emma, can I come to you next?
Hi, so I am Emma. I'm the panel listening today. From Marie Curie. I'm a volunteering development officer. I have, at the start of lockdown, we had a mad panic to put all of our volunteering positions on pause. And at present, we have very, very few back. So we have approximately 1,000 volunteers in Northern Ireland, and we have less than 100 people supporting us at present. The majority of the people that are supporting us are PPE drivers. So we put out a volunteer response team nationally at the beginning of April to recruit drivers to deliver PPE to our nurses across the country. We had approximately 50, mainly people who had been furloughed from work and just wanted something to do to help. Majority of them have now gone back, so we have less than 15 now able to help us across Northern Ireland. So we are looking to recruit drivers, but as they're non-contact roles, we have a less risk. They're picking up parcels and delivering to doorsteps. Regarding patient drivers, we have no need at the minute for them, as all services have been stopped except for our inpatient services. So majority of our stuff is on hold. Any volunteers that we do bring back, we have to have individual risk assessments carried out, including screening questionnaires for COVID symptoms and age-related positions as well. So we do have stuff in place, but nationally, as an organisation, we have paused all volunteering.
Okay, thanks, Emma. Kathleen.
Hello, everybody. My name's Kathleen Bradley. I work with Compassionate Communities Northwest. We don't provide transport, but our service users would rely on community transport services, and part of our befriending role with our volunteers would involve transport to and from different places. So since March, we have completely stopped all face-to-face contact. It's telephone support is what we offer, but I'm just here to get informed, as in kind of what everybody's doing the way forward when it does involve transport. For us ourselves, we don't see our contact befriending up and running before March, purely because both our community service users and volunteers would fall within the shielding categories. So it's just been cautious in terms of we just don't know what lies ahead. So we're eager to hear the announcement this evening as well. But I'm just here to fill myself with information for what yous is all doing at the community transport end.
Okay, thanks, Kathleen. Okay, I think I've got everybody except our two speakers. So what I'm going to do is I think I will come to Lauren next, Tim, if you don't mind, I think I will get Lauren just to obviously introduce yourself, Lauren, and then if you just share what you were going to share in terms of our experiences with our driving schemes in Volunteer Now, and then Tim, if you can come in after that and just pick up on a number of the issues. So Lauren.
Okay, good morning everybody. My name is Lauren Harrison. I work in the community projects team at Volunteer Now, and part of my role is coordinating the driving scheme. The driving scheme in Belfast is for older people, and it would be older people who would be vulnerable, lack social connections, and really need support to get to any sort of healthcare appointment. So come sort of mid-March, our driving rotas fell to nothing. We did have a couple of very vulnerable clients who needed transport to the likes of cancer treatment and also dialysis, because those appointments just kept on going. So we made the decision that we would continue with those during lockdown. And majority of those, a very small number of those clients already had been matched to an individual volunteer driver. So we wanted to maintain those bubbles going forward. Really, before we even decided that, we looked at our guidelines for both service users and drivers, and also our risk assessments, and then also how we were going to access PPE, because of, you know, sort of end of March, early April, trying to find even surgical gloves was a big issue for us, but thankfully we got on top of that. And we sort of put those measures in place temporary. We kind of thought, oh, you know, we'll maybe see how things go month by month, and we kind of reviewed those as things went on. But they looked like they're going to be a bit more longer term, not that 3 month sort of temporary period that we maybe initially naively thought it would be. So it was really about, for us, that constant communication with both our service users who were accessing the service and also our volunteer drivers. So that would involve quite a lot of telephone communication with both in the run up to each of their drives. And then also the day before their drive, I would have done a phone call to both and made sure that they were well, that the appointment was still going ahead, and sort of alleviate maybe any fears they had, and reminding them about hand washing, where they were positioning themselves in the car so that they were diagonal to the driver, making sure that they would wear a face covering. Majority of my clients were wearing those from the get-go, so there wasn't an issue there, and just sort of keeping in that constant contact with people seemed to work well. Come sort of around mid-July, I started to get phone calls from some of my other driving scheme service users who were asking, you know, can I access the scheme? I've got a dentist appointment, I have a podiatry appointment, as those things started to resume. So again, we had to get back to our risk assessment and our guidelines and chat to our volunteers, because we were operating on such a reduced level. So really we sort of use some of the guidance from the CTA to help us sort of build those sort of new checklists and guidelines for our drivers and our service users. So drivers were provided with a checklist, just going over the things that were sort of the key points in our risk assessment, and also things about if they display symptoms, if a member of their household displays symptoms, if they come into contact with someone who tests positive, those types of things that they knew what to do if that happened. And we also created a cleaning regime for them to follow a checklist, and provided them with suitable PPE to do that. And that would be stored within their car and laminated, so they had very clear guidance on what they had to do before and after each drive. Service users as well were contacted and informed of the changes to the service in terms of mandatory face coverings for, unless you were exempt, and also where they had to position themselves within the vehicle. And also some of our clients would have who would have used the service before would have relied maybe on one of our drivers offering an arm to get them to the car, to maybe take them in right into, if they were going to a hospital appointment, taking them right up to the door and getting them in safely. And all of that has had to, come back, and it just making people aware, sort of setting the tone that isn't how we're operating at the minute, and making them well aware of that before a drive would take place. So really for us, for me personally, the biggest thing has been constant communication. I've been on the phone with clients and drivers, nearly every day. I've been speaking to one of them, and also really now looking at volunteer recruitment, because probably like very many of you, a lot of my drivers were retired, and they would have been doing those drives Monday to Friday, and we have to kind of maybe look now to try and get some fresh blood in, because a lot of them would have been in that shielding category, or have decided, themselves that they maybe just don't feel that they can continue volunteering with us. So the big challenge really for us is recruiting volunteers, and also then continuing to look and review all of our guidelines, because as things change on a weekly basis, we need to make sure that we're doing the best we can to protect both our service users and our volunteers. That's me.
All right, thanks, Lauren. Tim, I will hand over to you, and then, after you've shared with us, I do think, we can have a conversation about all those challenges, and certainly I know I share the pain in terms of what Lauren's talking about. Recruitment is definitely something that everybody is having issues with. So, Tim.
Yeah, thank you. Lauren had just mentioned some CTA guidance. I've just put the link to that in the chat, I hope.
Thank you. Yes, I see it.
So if anybody wants to read that, you're more than welcome to use that and adapt that in any way you can. I think the big difficulty for everybody is the confusion on the message. And I think we've seen that even in recent days. A confused message has been given out, go and stuff yourself full of half-price food in August, and then you can't go to Weight Watchers in September because they've closed that down because more than 6 people can't meet. So it's all very confusing what's going on at the minute. And I think in transport, it's been equally confusing because there hasn't been common language between England, Scotland, Wales, and Northern Ireland. Each jurisdiction has used slightly different meanings to words. I mean, we've used this term essential journeys, and the whole way through the pandemic, we've been talking about essential journeys and transport. But in Northern Ireland, that term was never used. That wasn't the term that was ever adopted by the executive here. They never spoke about essential journeys. They spoke about permissible journeys, so journeys that were permitted under the legislation. So that was very much an English term, essential journey. So even within that, it's been very hard for transport operators of car schemes, of buses, of taxis, of whatever, to try and work out what you can and can't do, what you should and shouldn't do, and what's permissible and what's not. And I think when you drill that down to car schemes, I think it's been really confusing with car schemes, because the only 2 pieces of guidance that the government has ever issued is guidance in and around taxis. And also then, not in Northern Ireland, but the government at Westminster offered some guidance, just a paragraph, on car sharing. So car sharing is where if you've ever watched Peter Kay, and he has this car share TV show, that's exactly what car sharing is. It's really focused in and around work. So you're like Peter Kay, and I've forgotten the lady's name who he drove with, but they drove to Sainsbury's together every day, and that's what car sharing is. So it's basically people are incentivized by tax incentives to be able to drive other colleagues to work. So there was a sentence within the guidance on transport from the Westminster government that said car sharing can start up again for essential journeys. But that was around the time where Boris Johnson was saying, get back to work, stay at home, back to the office, but don't leave the house. So at that point in time, they issued this confusing guidance of you can use car sharing for essential journeys. Well, that's great, but car sharing isn't a voluntary car scheme. The only other guidance then we had issued about cars was on taxis. And at that point in time, the taxi guidance was basically, if I can sum up the couple of pages in a couple of words, was crack on. you know, taxis can be used for anything that's permissible. So if people want, you know, I heard Lauren there saying about going to the dentist or the hairdressers or those sorts of things, just get a taxi, you can do it. And that's the way taxis seem to be operating now, with a face covering, without a face covering, who knows what they're doing or what they're not doing. But taxis, it seems to be, well, if you want to take the risk, take the risk. If you don't, don't. So car schemes, it seems to me, falls between those two stools. And it's a real difficulty for us in CTA, because on the one hand, we had car sharing was for essential journeys only, and we had taxis basically just get on with it. So car schemes aren't car sharing, and they're not taxis either. So we came up with our guidance, which I've shared in the chat. And it seemed to us that there was really three types of services that car schemes were offering. Non-emergency passenger transport, and then we had lifts where you were bringing people to services that they needed to live, and then I think everything else. So those were the three categories. So you had non-emergency passenger transport, so taking people to their appointments, taking people to their outpatients appointments, taking people to, you know, whatever it is they need to do at hospital or the doctors. And then we felt there was a second tier of service where people needed to go to shopping. They needed to go to pick up their prescriptions. They needed to maybe get a lift-in activity that was going to provide them with exercise, which were all then, you know, essential journeys as the government had defined them, or permissible journeys as our government defined them. And then there was a third sort of tier of journeys, and that's kind of socializing, you know, going to the hairdressers once they reopened in July, you know, getting your cut and blow dry on a Friday afternoon, or, you know, whatever it is you do. And we were all relieved to get out to the hairdressers, I think. So, you know, it's very understandable that other people who had been at home for a long period of time wanted to do those sorts of things. So those were the three tiers really of car scheme journeys as we identified them. Now, non-emergency passenger transport, a lot of that in car schemes continued through the pandemic. Lauren's outlined for us a few things, you know, cancer care, those sorts of things, where people just had to go. And there were volunteers who were willing to do that through the lockdown phase of taking friends and neighbours and people that they'd got to know through the car schemes that they've been operating, were prepared to do that through the pandemic. So those journeys haven't really stopped, and as we're getting back up and running, as outpatients are opening up again, those seem to me to be the most obvious types of journeys that need to take place. But I think those journeys also come with probably the highest risk, and that's what we've identified in our guidance. So we thought about this long and hard, and we thought, if somebody's in the ambulance service, what would they have if they were an ambulance service driver? And they would have what's called level 1 PPE. And that is a face mask that's fluid repellent, an apron, gloves, eye protection for when you're in close contact with the individual who's been taken in and out of the ambulance. And it was our feeling that if a non-emergency passenger transport is taking place by the ambulance service, and that's what they would provide their driver in the ambulance service to take that exact same patient to the hospital, that's probably the least that we can expect to give our volunteers, is that level 1 PPE protection, that they have that as well. So that's kind of what we recommended in that. So almost, if a volunteer is prepared to drive for that non-emergency passenger transport, I think we need to treat them in the same way that we would treat a person who's a public servant, and give them the level of protection that the health service would give a public servant. I think that's the very least that we owe those drivers who are giving up of their time on a voluntary basis. And then as we move into sort of the things like food shopping and those sorts of things, then I think things become a little more difficult and a little bit more tricky to navigate, because obviously people need to get out to be able to do the things that they need to do to live their lives each and every day. And I think that's where we really have hit the massive bump in the road, because non-essential journeys, we're really recommending that those don't take place right now. If it's people wanting to go out to socialise or to go to the hairdressers or that sort of thing, it's maybe make alternative arrangements, have the hairdresser come to them if you can do that, or make alternative arrangements for, you know, people to be able to go into people's gardens or whatever, where there's better ventilation, for those sorts of activities to take place, or help encourage people in different ways to socialize. But these sort of middle journeys where it is about people living, it is about people exercising, about people going to shops to get the food that they need, about people going to pick up prescriptions. I think that's where we've hit that kind of difficulty as to what do people do. And I think a number of the issues have already been raised in our conversation. And I think that the key issue that everybody who's tried to start up their car scheme has hit is who can volunteer. And the key question that people are asking is, can older people volunteer on car schemes, particularly when they're in a situation that's quite vulnerable? And I think something that we need to work out what we're going to do in community transport, and I think in car schemes in a more wider sphere, because I think Lauren was touching on this as well, is the age demographic of people who volunteer for car schemes tends to be people who are older. The demographic really is sort of 65 to 75. That's the demographic of people who volunteer in car schemes. And for some reason, I was just talking to a member of ours yesterday as I was preparing for this, and that gentleman, he runs the biggest car scheme in Scotland, and they have 4 drivers under the age of 65 who volunteer for them. 4 drivers, and I don't know how many hundred drivers they have, but it's in the tens of hundreds, maybe over 1,000 volunteer drivers that they're operating with in their car scheme, and they have 4 under the age of 65. And that statistic, when he said that to me yesterday, really blew my mind. What is it about car schemes, and what is it about car schemes that we can't get people under the age of 65 to volunteer in? And I think, I was reflecting on that a bit over the last 12 hours since I was speaking to him, and I think the 24 hours speaking to him, but that I think for younger people, they tend to take transport for granted. We tend to, if we don't have a car, we can get to the bus easily enough. We can get ourselves there. We can take a taxi, or there's one of our mates can come round and pick us up. So people who tend to be middle-aged down to in their early 20s, transport's very much something that's taken for granted. But I think as people get older, they start to realize, I have to start ticking boxes to get my driving license back. And while I have that, that's a gift that I want to share with other people who have lost it. So I think, we tend to see that people who are in more of that older demographic, that for them, it's something that they can see that it is something that's problematic. It's not just as easy to pick up transport when you need it. So I think for us, we're thinking now about how can we tap into the thousands of people, millions of people, if you take it across the UK, who signed up to volunteer during the pandemic. How can we start to make volunteering in a voluntary car scheme something that's more attractive to younger people? But anyway, that's something to work out over the next few months. That's not for today. But I think critically, we're at where we're at with that older demographic. And what can we do? Now, our recommendation is CTA, and we've had a lot. It's probably the number one thing that we've had pushback and feedback from our members on is this idea of people over the age of 70 driving. Now, we've picked in our guidance, rightly or wrongly, over 70s as a group who are vulnerable and who are shielding, and we have recommended to our members that volunteers over the age of 70 are people who drive. Now, that's taken away the potential pool of maybe 50 to 60% of your volunteer car drivers. So you're left with a 35-40% of volunteer car drivers who are aged 65 to 70. Now, what's this magic threshold of 70 anyway? So people of all ages, I think, are vulnerable to this disease. So I think it just provides a real difficulty in getting car schemes back up and running as to what protections can we give to people who are in that age group of 65 to 70, who are current volunteers who still want to volunteer. And that's something we've really struggled with, I think, in CTA and with our members. And what we're recommending really is a lot of the stuff that Lauren's talked about, but even within that, there's confusing evidence that's coming out in the research. So even the position of a person in a car, do they sit diagonally behind the driver? Is that the best place for the person to sit? Some research suggests that the best place for you to be is beside the driver because, droplets are going forward, but most people turn to talk. So I don't know. If everybody's wearing a fluid repellent mask or a surgical mask, does that help? Does that aid? And I think all of these things are gonna be worked out over the course of time, because I think with all of this disease and everything that we're doing in and around, not just with car schemes, we're learning as we're going. Each and every day we're picking up different information, we're picking up different things, we're learning different things, we're really learning as we're going. But I think the things that we have learned really on CTA is making our volunteers feel safe is the number one most important thing. And how do we do that? And if that's given level 1 PPE to everybody who's driving, if that's going to make volunteers safe, then that's something we need to do. I think the second thing is that we've learned is keeping communication open, is speaking to your drivers. So a difficulty that the gentleman I was talking to yesterday, who runs the car scheme in Scotland, a difficulty that they have encountered as they've opened up their car scheme is a volunteer car driver goes to the house of someone that they're to pick up. That person is not exempt from wearing a face covering on public transport. The volunteer goes to that house, and this person has been told by the car scheme that they're operating under that they have to wear a face covering. The volunteer is satisfied by that; they're wearing a face covering. They arrive at the house, the person says, "Well, I'm not wearing one." So what does the volunteer do? Now, if it's somebody who's an employee, so if it's one of Paddy's or Deborah's or Leslie Ann's community transport services, well, that's an employee, and that's one thing. That employee probably feels that they could ring back to the office, or could probably feel like their boss would back them up if they say no to this person, because they've had those procedures drummed into them and they feel a little more confident about what their position is. But what does a volunteer do? And they've had a number of volunteers who've then phoned up after that journey and have said, "But we're not volunteering anymore because you told me that person was going to wear a face mask." They refused, but I didn't want, as a volunteer, not to take them to their hospital journey, and I felt I had to, and I felt I had no choice. So I think it's saying to the volunteers, no, you don't have to do that. You phone me, and I'll run interference for you. You know, I run this. You're a volunteer. We value you. We respect you. We respect your position and your preferences. We respect that you have certain things that you're worried about, and we don't want you to be in a position where you feel that you're being put in a place that's vulnerable for us. And I think it's what Dawn in Scotland was telling me yesterday. It's about getting that communication open, and that's been key for them, is to say to their volunteers, you have an open communication to us, and if you feel unsafe about anything when you're on your journey, you come to us, and we're the ones who'll sort that out for you. And I think now that they've been able to do that and to be able to interact with their volunteers better, and that the volunteers who are operating the service are starting to feel better about that. But I think the key issues that we've got is funding. So if we're going to go forward with a new normal in and around volunteering, and if we're going to offer level 1 PPE to our volunteers, that's going to cost money. And there are some funding schemes available across the UK, and some funding has been made available here in Northern Ireland in and around getting PPE, but not for voluntary car schemes yet. And this is very expensive. It's very expensive for each journey, and it adds an expense onto the journey. And I think we need to see in some way that funding is given to enable people to feel safe within the car. And I think unless we get that funding coming forward, it's going to be difficult for people to continue to feel that they can safely run their car scheme. And I think the other thing that we need to do is to try and standardize best practice as well within the car, and help volunteers feel that they are following a regimen that's of best practice. So I think it's really bringing volunteers in and training them in how to feel safe, how to clean their car between each journey. A big thing that we're hearing back is volunteers saying, "I would love to drive, but the one thing that I feel really unsafe about is my car becomes a petri dish, and then I go and I do something in my car, or I pick up I'm starting to pick up the grandkids again from school. Am I going to transmit some virus from my car to my grandkids or whatever?" And I think we need to then bring people in and show them how they can safely do this sort of cleaning that's required. Now we're recommending, and this again is another expense, that internally within the car that disposable car seat coverings are supplied, and then after each driver, each passenger is taken, those car seat covers are disposed of and fresh car seat covers are put down. But again, that's an expense, and again, that's money that's going to have to be paid out. Now, the other thing that we're recommending, but is proving very difficult on the ground to implement for the safety of volunteers, is volunteering bubbles, so that we try as far as possible to match a volunteer to an individual. But because the numbers of volunteers are so depleted, it's working out to be almost impossible to do that. Because what would be an ideal situation is if you can get one volunteer to be assigned to one individual, and whatever those individuals' needs are, going shopping, going to the hospital or the doctors or to pick up prescriptions, that only that volunteer deals with them. But given the depletion in volunteers, it's proving exceptionally difficult to put those safety bubbles in place. So I think, like in sum, I think it's really about ensuring you've got your risk assessments done, ensuring that you have a safe way and a safe code of conduct and practice that you've thought about and you've put in place for your volunteers. So in and around cleaning, in and around ventilation. And on ventilation, I think the big problem in that is we're heading into the winter. Are people really going to want to be in a car with the windows cranked halfway down? And I think that's going to be a problem for the wider community transport network across the UK. Is even in buses, are people going to want the ventilation systems cranked up to the max? I think another thing is think about the length of journeys as well, because the longer the journey, the more chance there is of coronavirus being spread. And I think the crucial thing in all of this is helping your volunteers to feel like they're part of the process, that they're being listened to, that their safety concerns are being taken on board, that they feel that when they get back into the car that they know that they're safe, and that they feel that they have an open line of communication to you to raise their concerns in a way that that they're being taken seriously and that they're being remedied and rectified. Because as I said, just to go back to that point, like Don in Scotland has precious few volunteers now, but he lost a few volunteers because the volunteers didn't feel that they could come back to him when somebody was refusing to do what the practice and procedures were, and they didn't feel they had that line of communication open. So I feel like that, because when I was speaking to Don yesterday, he had said to me that's the number one thing. If he could go back to July when he started up his service again, he would love to say to some of the volunteers who've dropped out, no, you speak to me and I'll sort the problem out. You don't need to. And he didn't really impress that upon them at the start to the degree that they needed. So I think that those are really the things you've got to think about. And I think it's critical what Lauren was saying is about doing the risk assessment. And for some people, that's going to have to be an individual risk assessment, because gone are the days when you're going to be able to take that person by the arm to the car, help them in, take them by the arm to the hospital, sit and wait in the hospital waiting room for them to finish. You're not going to be able to do that anymore, and then come out with them to the car. And I think it's about doing those risk assessments and making sure that your volunteers feel empowered to be part of those risk assessments and put their input into them as well. And I think that's going to be crucially important. Don't forget about that. Don't say that this is a risk assessment that's imposed upon them, that this is a risk assessment that they have ownership of too, and that they feel part of and they feel comfortable with. And then I think finally it's about training. And I think that's part of making volunteers feel safe. It's showing them how things are done, showing them what they can and can't do in a very clear and affirming way, and allowing them to feed into that process. So there's a lot more that we've got in our guidance, and it's in the chat there. But probably with I think, Sandra, maybe our time's nearly gone, but a few questions maybe would be worthwhile.
Absolutely, please. The floor is open, certainly, and thank you, Tim, for that. It's certainly, as I'm sitting listening to you and listening to Lauren, and I know from being a member of staff within Volunteer now, like it's just this is very, very challenging. There are so many decisions to be made. You know, we have risk assessments coming out of our ears. You know, we've talked about guidelines. There's guidelines galore, and as Tim has rightly said, sometimes you think you've got it and then it changes, or you know, people trying to understand some of the guidelines. Sometimes it's really, really confusing. You know, with big messages this morning about communicating with our volunteers. You know, it's good practice at the best of times, but never more than now, when we really need to be communicating constantly with them. You know, keeping our volunteers safe is absolutely and utterly crucial. But as quite rightly, as you've said, you know, providing all this equipment is costly. I'm glad to see a wee bit of networking going on the chat there in terms of where to buy covers for seats and things like that. Again, that's good that we can do that at these sorts of sessions. And also, obviously, the induction and training for our volunteers is absolutely key in terms of making sure that they know what they can and can't do, and that they can, when they run in and have run into a problem, that they can phone back to you guys, because it's not their responsibility to sort it out. And obviously, underlying all of this, there is this whole issue about recruitment in terms of, you know, as Tim quite rightly outlined, the demographic of volunteer drivers is that of older people, and therefore, and it's not just within volunteer driving. I did one of these with charity shops last week, and, you know, it's the same there, and we could mention a whole list of rules, because a lot of older people do volunteer for all the reasons that we talked about earlier. So yeah, real challenges. The floor is open. Please use this time to get information. Catherine, I would say to you, as someone who is new to this, who is learning as you go along, please make contact with Jamie here at the end. I would say to everybody, if you're not on our Be Collective system, do get your opportunities up there, because, you know, Tim alluded to the number of people who did come forward at the start of the pandemic to volunteer. There are people out there who do want to volunteer. Now, not everybody will want to drive, not everybody will be able to drive, but if you don't have your opportunity on that system, you're not going to make contact with any of those people. So do get your roles up there. And I say, Jamie, I'm sure we'll put his contact details in the chat there, and you can get involved with them. And again, Catherine, I don't know how connected you are with the rest of our organisation, but certainly there's guidelines galore coming out here. There's training and that sort of stuff to help you in terms of setting up what you need to set up. But as I say, the floor is open.
Yeah, and sorry, Sandra, just on that point, Andrew Hannah actually got in touch with our director.
Excellent.
Who forwarded it to me, and then Andrew gave me a Zoom on Be Collective earlier in the week, which is brilliant. So
good.
Thanks to all of you. It's been really useful. Thank you.
No, that's good. No, as I say, we've all been there, Catherine, so we know what it's like. And some of the people here today have been, you know, involved in driving schemes for well, we'll not say how many years, but a long time. So there's a lot of experience in the virtual room today. So what are the challenges? Any comments? Don't forget to unmute yourself if you want to ask a question. You know, Paddy, one of the things that Paddy raised earlier, obviously, was this whole dilemma between the duty to care to your volunteers and the need, you know, for the service. So, again.
Can I ask make a couple of points, please, Sandra? Just on we talked there, it was mentioned just briefly in passing about potential for using sort of a driver's shield or some sort of a thing. I know if you Google it, you can get, I bought a couple and they're an absolute nightmare. Has anybody found anything suitable that you can safely put around a driver to have some sort of barrier between the client and the driver? Not that it'll not be airtight, so you're not solving the sort of the circulation problem and the air problem, but we have fitted flexible plastic shields behind our minibus drivers, and it only covers behind them and round sort of to their elbow a bit, but it's to avoid that potential, what I describe as you know, a direct hit from a sneeze or a cough, just to eliminate that at least. Has anybody found anything like that has worked for them? And then the only other point I want to make is there's 2 or 3 now in our community transport network. We have our own geographical areas, and it's very tidy and clean and we don't fall out with each other. But there's people on this screen have talked about recruiting volunteers and activities across the whole of Northern Ireland. And, it's very dangerous to say, and somebody might say, shut up quick. But, is there an opportunity for us to share volunteers a bit? Now, then you're into serious territory of somebody stealing your volunteer and you never see them again. But that notion of, I know that was it Emma from Marie Curie talked about, potentially, non-contact roles. If there was work needed to be done in Derry or Strabane or Omagh that involved transporting equipment and not people, well, then all my volunteers now become available for those runs instead of my 16 or 17 now out of 35. So whether there's an opportunity for organisations to work together, but whether they're sharing the volunteer or whether the organisation comes to me and says, can you get your volunteers to do this and we'll cover your reimbursement or something. But I'm wondering, in a conversation like that, is there a wee bit of room for sharing of volunteers or organisations working together? Because although we're saying we can't get them, I'm sure there's still a situation where some of us have a bit of volunteer spare capacity in a certain area. It never works out that you've got perfect coverage. Some areas you have too many volunteers, in other areas you don't have enough. But whether that's an option for again or for people making contact after the meeting, but Volunteer Now is probably well positioned to sort of facilitate those types of discussions. But
if I certainly take your latter point there, Paddy, and then somebody else can maybe talk about the screens and things. Certainly, that's the one thing when lockdown started, or when the pandemic started, the whole thing about volunteering was that people were working so closely together, and there was an element of sharing volunteers, and groups were popping up all over the place, and volunteers were coming out of the woodwork from all sorts of directions. So, like, we would strongly encourage that that organisations do make those connections with other organisations. If you know other organisations in your area, contact them and have the conversations and see what you can come up with. It definitely, as you say, there may be some who, a lot of volunteers were stepped down for a number of reasons and didn't have activities at all to do, whereas other people were crying out for volunteers. So and these sort of sessions are important to help you make those connections. So. Does anybody have anything to answer in relation to Paddy's first question about the screens or some form of protecting the volunteer drivers?
The only thing I would say, Paddy's right to be looking at sort of plastic screens, is if you're going to put anything in the car, make a modification to the car. Well, number one, I don't think many volunteer car drivers are going to want you to do that because I don't think they would want any sort of semi-permanent solution in their car. But you do need to be careful if you're putting something in the car from two respects. One, from a DVA respect, that could be deemed a modification, which would mean make your car non-roadworthy. And I think secondly, if it's something then that maybe it flaps down and distracts the driver, could put the driver in a position where they may well be charged with dangerous or careless driving. So I think from those two perspectives, anything that you do put in, be very careful with it. My advice would probably be don't do anything. There's nothing really on the market that's any good. It's certainly not going to protect you from the virus. It's may make the driver feel a bit safer, but I think the risks outweigh the benefits. I think probably a face screen, those plastic mask things, whatever they're called, a screen is probably better because that deals with sneezes with a face covering on underneath. And you put on the screen when you're helping the person in and out of the car. If they're in the back seat behind the driver, it's probably unlikely that a sneeze is going to be directly in your face. So those face screens are as effective as a plastic temporary covering. I just feel that the risks that are involved in those plastic coverings probably really outweigh any benefits.
Okay, thanks, Tim.
Sorry, Tim. And when you say face screen, like a visor type thing,
visor, I can't think of the proper term. The plastic things.
Yeah, the teachers at my kids' schools wear this kind of visor type thing. Is that what you're?
That's what I'm thinking. Yeah.
Oh, good. Okay, that's helpful. Thank you.
Something like that. That's as effective as anything else, because those visors or a screen or anything, it's just to stop a direct sneeze or breath particles, and they stop it as good as any sort of plastic screen that you can put up. So, you know, so the risks of actually putting something up really outweigh the benefits.
Okay, thank you. We have run out of time, but has anybody else got any pressing questions or comments? Okay, they're all very quiet. Okay, well listen, I will not keep you any longer. Thank you so much for participating. Thank you to Tim and Lauren for your input, but also to everybody, because those wee snapshots at the start are really helpful in giving us a feel for what's going on out there. So stay safe, everybody, and keep in touch. Okay, bye. Bye. Bye.